Welcome to Lasting Lifestyles, a support program for caregivers and families. Hello, I'm Janet Corbally, Director of ViBridge Connections, and I'm very pleased to have joining me Dr. Alan Nasar, who's an orthopedic surgeon from Central State Healthcare System. Dr. Nasar, thank you for joining us.
You're welcome. Good morning.
Good morning. You deal quite often, obviously, as an orthopedic surgeon, trying to really provide some relief and comfort for people who come to you with a variety of issues, and especially dealing with pain.
Yes.
And as an orthopedic surgery, especially when we're thinking of people who are dealing with hip pain, and especially sometimes with our older population and dealing with some of these issues. And from what I understand, arthroscopic surgery has been something that has revolutionized surgery. So could you really explain to us what is hip arthroscopy?
Okay. Yes, sure. Arthroscopic surgery really has revolutionized surgery in many ways, not just in orthopedics. It's called laparoscopic surgery in the abdomen, figure laparoscopic hernia repair or gallbladder surgery. In orthopedics, we do arthroscopic knee surgeries quite routinely, and that's a surgery done through 2 small incisions in the knee, and that deals with a lot of problems with the knee joint. Also with the shoulder joint, rotator cuff repairs can be done arthroscopically. This has been going on for about 20 years. Recently, we've adapted the arthroscopic techniques to treatment of hip problems. And the hip is a very hard joint to get into otherwise. In other words, the shoulder and the knee, actually, you can get to the joint by making an incision and then moving the joint out of place and looking inside it. The hip, that's very, very difficult. So having the ability to look inside the hip joint with small incisions and arthroscopic instruments has opened up a whole new area for us to treat patients with problems inside their hip joint.
So it just sounds so non-invasive, and you know, when you're describing the technique, how is it actually performed?
Well, the patient is placed in a little bit of traction to gently sublux or pull, open up the hip joint so that we can get our equipment inside there. And then we use long, very thin, about 5 millimeters, which is a little more than 1/4 of an inch, objects with fiber optics and cameras to look inside the hip joint, and we can use shavers to shave down cartilage defects or problems, and more advanced techniques can actually repair tears or other problems with suture and anchors and different types of things. It gets technical, but the point is we can get in there, we can certainly look around, diagnose problems, and treat some problems as well with the arthroscope.
It's amazing, just in what you described, and you're just going in with, these minor incisions.
Yeah.
Now, does someone need to stay in the hospital? I mean, what's the recovery?
Not usually. Generally, the recovery is quite quick. It depends how extensive of a surgery, how extensive of a problem. A general arthroscopic patient will leave the same day, will be walking out of the hospital, maybe with a cane or a crutch or something at first for a couple of days, but generally they return to work or their activities in a very short time, within just a couple weeks. And then with physical therapy, they can return to sporting activities and leisure activities, usually in about a month or so.
Now, with the arthroscopic surgery you've just described, is this something that is generally practiced out there now, or are there is there specific training required for doctors? I mean, how does someone really be discerning and going out and finding the right doctor? Because it just sounds technical.
It's always difficult, I think, to find a doctor who does a particular thing well, because you go into an office and, a lot of times people will say, yeah, sure, we do that. Hip arthroscopy is really not practiced widely. If you go to a hospital, there might be one person on staff doing it, unless you go to a very large orthopedic hospital, let's say. Generally a fellowship-trained surgeon in either sports medicine or arthroscopy or hip replacement. It could be anyone who has taken the time to learn the skills who is an orthopedic surgeon. would be able to do it. But you have to ask the questions, because not everyone's going to do it. In my hospital, I'm the only person who's doing hip arthroscopy right now at Centra State. So you just have to ask questions. For the consumer, hopefully your physician can give you some information, or if you contact an orthopedic surgeon, they can probably tell you who they know does hip arthroscopy and does a good job at it.
Make that referral for you. Yeah. Now, what kind of conditions are you treating when you're actually going in and doing this type of surgery?
The best conditions to treat with hip arthroscopy would be loose bodies, let's say. That can be very well treated, meaning you could have a bone chip or a little chip of cartilage floating around and getting caught in the hip joint. Arthroscopic surgery can treat that very well. Remove the chip, very little damage to the other tissues, and certain cartilage tears can be treated very successfully. Early arthritis, I think, can be treated, but arthritis itself is not really a disease that gets much better with arthroscopic surgery. So we have to be careful about not using it too much. When something new comes out, the tendency is to want to sign everyone up for it. But I haven't seen patients with especially more advanced arthritis have any benefit from arthroscopic surgery of the hip.
Now, are there any complications associated with this type of surgery?
Generally, it's very low complications. The usual surgical complications are infection, nerve damage, blood clots, these things, and it's just very rare. Some patients do get a little bit of numbness from the traction, probably 10% or less, but that's something that I think happens earlier on in the learning curve for the surgeon. If you learn to do the cases quickly and use the proper padding, that doesn't seem to happen, and it generally resolves. So I haven't seen any real problems with the surgery.
Okay. Now, if I've had this surgery, and you have described earlier that it's a pretty quick recovery time, that people can get back to their normal activities. What is the success rate? Is this something that's long-lasting, or will I be coming back again?
Yeah, it depends very much on what the problem that's being treated. The first thing I mentioned was loose bodies. The success rate would be extremely high. The chip, for instance, is removed and it's gone. It's never going to come back. Same thing with a labral tear, a cartilage tear in the hip joint. That can be treated pretty well. If the joint is otherwise healthy and now you've removed the problem area, then you can expect that would be very successful. And then the third thing that I mentioned was arthritis. That is treated, the worse the joint looks, the worse the global damage is, the poorer the long-term prognosis is. And if someone has arthritis that doesn't respond well to, let's say a hip arthroscopy, then a total joint replacement would probably be the next step.
Dr. Nasar, it's amazing what technology is doing for us today in our quality of life and wellness planning. Thank you so much for joining us.
You're welcome. Thank you.